Now we're going to demonstrate using electrotherapy with the high frequency modes and the electrodes here. So I have my little kit that comes with this multifunction machine. We have one that is for the hair, which is an attachment for combing through their hair. Let's say that they might have really oily scalp or dry scalp, and yet this from excessive oil. We can comb through and bring a balance to their scalp problem using this electrode. So that's a really good attachment. And then this is our sparking one, which is for zapping acne, pimples, for healing up lesioned skin that needs the benefits of the high frequency. And then we have the mushroom one, which is good for all over treatment. It's easy to use. And then we have another one that's a little bit different shape, and it is more rounded and smaller in size for getting around these areas. So you have the four different attachments. Usually there might be some more, 5, 1, 2, 3, 4 attachments I have. So the mushroom one is probably the one that we use the most, or the zapping one. Now, a little safety precaution for your high frequency is when you're sterilizing them, you'll sterilize them in the container without totally inserting. Don't ever insert the silver electrodes into the sterilizing liquid. Just these attachments, just the ends of the glass. Now, to talk about some of the benefits of your high frequency, it is disinfecting to the skin, it's antiseptic, so it's good for acne skin, oily skin, minimizing those pores. It creates also heat and oxygen to the skin. So now sometimes facials and aesthetic salons are using it for anti-aging, but I personally feel that the galvanic or the ultrasonic is my preference for anti-aging, because those the ultrasonic attachments are a brightening to the skin, and it breaks up dark circles, and it's anticoagulating, and it helps the skin to products to penetrate, such as collagen and the natural Botox alternatives. So that's the ultrasonic for anti-aging. But the high frequency is really good for creating warmth to the skin. So don't use it on skin that is inflamed, on skin that is very sensitive, like cuprous skin, or very thin skin. It's more for the thicker skin, or for getting heat and oxygen to the skin in a very quick, effective way, and sanitizing the skin. So it is beneficial for that. The galvanic is beneficial for anti-aging, for unclogging deep pores that are clogged in, and for helping to close the pores and then make the pores more refined and smaller. So let me show you how we're going to attach these attachments here. So I'm going to make sure that my other functions are turned off, and the galvanic is my second function. So when it's flashing, it is on. And what we are going to do is wet a sponge. You just do that. So we have 4 attachments on the galvanic electric therapy mode, and they're attached to 2 wires. So they're already set up, so it's easy to figure out the electricity and the currents, whether it's positive or negative. Positive repels negative, positive and positive, they attract. So you have to use your you should read and study this. The galvanic section in detail is in your textbook in the Milady on page 459 to 462. So the process that we create that is done with this is called iontophoresis, which is a process that positive attracts negative, positive attracts negative, and positive repels positive. So like repels like, and the opposites attract. So disincrustation is what we mainly use this for, which I did show it, I think, in the full facial treatment, but just to highlight on how to use it, we're going to use the large rolling one. The small electrode is more for around the nose area, which actually is used a lot because you get a lot of blackheads and clogged pores around the nose area. But you can switch them up very easily by turning one set on and one set off. So I can feel the heat in here already a little bit. So we have two wires that are attached with each other. One is the grounding that the client holds, or else you can put it in a dampened sponge underneath their shoulder. So she doesn't have hands, my model, so I'm going to do that. I'll just move my electrodes for high frequency out of the way. So I'm just going to put an extra little towel right here under her shoulder so we don't get the bed really wet. And I'm going to put that sponge touching her skin and that electrode right there. I'm going to wrap it around, actually, is the best way. There. Okay, so that's under her shoulder, wet with a sponge, so that grounds her. And then this one is attached to the same set of wire, so I won't use one electrode from another wire that's not attached to the grounding one. So if you want to change the attachments, you can change either the whole set or you could just change the electrode that you're using. I have it very well set up. I can just change the whole set. I don't have to change the electrode. But either way will work for you. Okay, so we're going to use the rolling one first. So we're going to put on her skin some of the gel, like a conductive. You have to keep it wet for sure, or with some kind of product. So I would put it in my dispensing container, but I could just put it on her skin. She has oily skin, this one now, and so we really want to unclog those pores. So we're going to use the rose and hibiscus glycolic acid gel mask as a conductive to make it slip and to really help it to work here. So this will make her skin just really roll off afterwards, so don't be surprised. It will do that. I'm not putting on the disincrustation liquid, would help it to break up and unclog the pores and open them up and turn that clogged sebum and oils into a soapy substance. But because I'm using my model here, that won't work as easily. So this will be my conductive gel. So I'm going to begin by starting it on her skin with my hand so that I can turn on the machine. I'm going to turn on the galvanic. You want to keep it always moving. So flashing is on, and then we're going to use the positive mode here. We're going to begin with, and we're going to start to raise and increase the strength until she tells us. So yeah, she has thick skin, so she can feel it at number 5. So we have our directions for the mode that we're going to use it on. And that chart is from side to side on the forehead. And then you're going to come up and around on the cheek areas. Around the chin, always keeping it against her skin. If you remove it from her skin, it's going to cause a little bit of a tingling, like sparking kind of feeling. Up on the cheeks, on the jawline, in on the cheek area. In on the cheek area. And then let's stop it and change for around the nose area. And with galvanic treatment, only spend about a minute on each area. Because you don't want to oversaturate and stimulate and cause them to be too red. So let's stop this, turn this off. And then we're going to change the attachment instead of changing, changing the electrode that's grounding. This one this one unscrews. The grounding ones just pull out. All right. So then let's make sure that it's wet. Her skin area has to be wet. Let's lower the frequency and then put it back on. So this is the area around her nose. Keep it touching, then unclogging those pores so that then you can extract. You can do extractions after this. So not for too long, no longer than a minute. And then we're going to do her extractions, put on a hot towel, close the pores, and then come back to do the second step of the sealing the skin and tightening the pores would be your procedure. So before we take this off of her, we're going to lower it or turn off the machine right away, totally, before we remove it from her. All right, so there's your galvanic procedure.